JFAC had one day of budget hearings where the public could come in, and we had a couple of hundred people come in and tell us what the real issues that they were experiencing. And those issues basically fell into three categories. House Bill 260 last year required people to choose who were actually getting services from both the developmental disability waiver and from the mental health waiver. House Bill 260 required them to only receive services from one program or the other, but not both. Well, as it turns out, not being able to receive services from both really put a lot of people without services that they were required, and immediately law enforcement started telling us that a significant number of people were running into problems with law enforcement, particularly the people that couldn't take care of themselves, etc. And the other thing that we heard is that it's pretty stringent with respect to dental care. And particularly the people on the developmental disability waiver and the age and disabled waiver. Those kinds of people very frequently require anesthesia, etc., to take care of their dental problems. They're unable to sit in a dental chair and control their actions, and so you can't work on them except under anesthesia, etc. And that program had been eliminated. And the cost of those two programs to restore them was $1.5 million, which we did restore those. And House Bill 209 makes changes to that program of House Bill 260. So we identified those two areas as critical needs that needed to be funded this year. And then, of course, the third is the suicide crisis hotline, of which we funded $50,000 out of the Department of Health and Welfare to help that program get started, and they have other funding from other areas.
All right, so perfect.